All right, thank you so much. Welcome to another episode of the Love Hope Lyme podcast. My name is Fred Diamond. I'm the author of Love Hope Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. And Dr. Patterson, the book is available on Amazon, but the PDF has been available for free. I've made it a free for chronic Lyme survivors from day one. We've given out close to 2,000 copies. If you're a chronic Lyme survivor and you like the PDF of the book, just reach out to me either via Facebook Messenger or LinkedIn. We'll definitely get it to you. If you're listening to today's show on YouTube, thank you so much. Go up, give us a thumbs up. We would greatly appreciate that. If you have any questions, feel free to put them in the comments, and we'll get them to you as well. We'll try to answer them. And if you're listening to the show on Apple Podcasts, thank you so much. Go up and give us a 5-star review. We would greatly appreciate it. So I got Dr. Jaquel Patterson, the author of Women in and Lyme, an integrative guide to better health. Dr. Patterson, it's great to see you. Thanks for being here.
Thank you so much for having me on the show and, for all the work you're doing for the Lyme community. So thank you for having me here. Really excited to talk about my experience with Lyme and also to share as it pertains to hormones and women's health.
Yeah, so I read the book. I read it a couple months ago, and it's a fascinating book. And a lot of times I'll see on the various Facebook or Instagram support groups or Reddit, do women have more Lyme than men? Why are so many women? Is it factually correct or whatever it might be? And you may or may not be able to address that, but you go through so many amazing issues in your book, and very clearly, by the way. So I just want to acknowledge you. It's a very clear, comprehensive, and well thought out book. So congratulations on that. And I presume it's available anywhere you would typically get your books, correct?
Yes, yes. You can get on Amazon. It was an Amazon best-selling book, so that was great. But Barnes and Noble, many different resource outlets to be able to find it.
All right. So Dr. Jaquel Patterson. So tell us your experience, your medical experience. What's your story? Why'd you write this book?
So the reason I wrote it, so first of all, personal experience, I also had Lyme disease, Bartonella, as well as Babesia. And I got to actually even testing for myself from working with patients who had the same exact story and the same experience that I had when I likely had got Lyme disease. And so for me, during the time it was my leader year in my 4-year naturopathic medical program, and I just had a lot of fatigue. I felt like I was always like a lot of fogginess, brain fog. One of my other biggest symptoms was a lot of like heat intolerance, where I was having like hot flashes and I was drenched to the point where I didn't even realize until I looked back that I was wearing black and navy blue for like a year and a half because I would be drenched. And for me, it was just like one side of my body. And so at the time, I was 28. You're just told, as many women are told, like, this is just anxiety, this is just stress, you're at the end of school. And I do struggle or have had experience with anxiety, but I said, this feels different. Like I'm going to the grocery store and I'm doing things that don't make me nervous and I'm drenched. Or as a student clinician, I wouldn't even wear the white jacket because I was so sweaty. I would sweat through my jacket. That's how like obvious it was. And so I'm like, this is a high level. This doesn't feel like it's just anxiety. And so I started doing a lot of work personally on like self-care, and I did, adrenal support, endocrine support. They actually thought it might have been an autoimmune condition, just like many of my patients, because I have a family history of autoimmune conditions, but nothing really came out. I had some unusual lab markers, but nothing that was significant. And then fast forward, I started working with patients with Lyme disease, and like, these were many of the same things that I had, and I never really fully got tested. I tested, sure enough, it was like IgM clearly positive, Lyme, Babesia, Bartonella. I went through my, treatment and things like that and was better, but it was from my own personal experience and speaking with people with that had Lyme disease, particularly women. And we know in the Lyme world, when people are just dismissed in care, they see 7 to 9 doctors at least. before they get diagnosed, but that's even worse, like statistically for women. And so when I started working with women, I would hear the story over and over again, like it's in your head, or you have a lot of stress with your kids, or this is hormonal. And I found there was a connection. Like hormones did play a role in making it worse or better, but I realized there wasn't really any story or information out there in terms of Lyme books or any infections on tick-borne diseases that talked about like women's health and hormones. And so that's why I came out with this book. It was from my own experience, and it was from really the stories that my patients shared.
Wow, that's kind of remarkable. Tell us what kind of a doctor you are so that people have the context here.
Oh yeah, I didn't. So I am a nationally recognized naturopathic physician. I've been practicing for 16 years. I'm based out of Connecticut, which we know is Lyme Central, but as we also know, it's throughout the country. And so I've been practicing with a focus on Lyme disease, integrative psychiatry. I would say a lot of the people I say also have psychiatric pieces related to Lyme or just outside of that. PANS, PANDAS, and then I also do a lot for autoimmune conditions. So those are the most common conditions I see.
Well, tell us a little more about the book. You told us why you put it down, but
Mhm.
you have so much is in the book, and you're right as you gave that answer. The summer of 2021, when I decided to become more educated on Lyme, I read every book that was up on Amazon, and literally every single book. The summer of 2021, uh, but you're right. There was no book specifically for women. There were some real thick books that went into detail, and there were some books written by women who had chronic Lyme disease, Yolanda
Mhm.
Hadid, Tommy Hilfiger's daughter, about their own personal experiences, but they didn't go into it from the clinical side in a lot of ways that you did. So tell us a little more about what really drove you to produce the book. And congratulations, by the way,
Thank
on
you.
publishing such a good book.
Yeah, and what was really important to me was the book was also educational on learning about like women's health, learning on like herbal medicine, herbs that are used for women's health, things that are used, understanding all of the systems, adrenal glands, endocrine system, the hormones. So I always say it's like a trifecta. You have the thyroids, adrenal glands, and the hormones together. And infections like Lyme disease, tick-borne infections, they will actually disrupt all of that. They disrupt our HPA axis. They'll disrupt our cortisol dysregulation, which then has a direct role in the thyroid, which will also affect the hormones. So they're all interconnected. So part of the piece what was really important to my book was just like also education on that. So there was kind of an understanding of your like these that we don't work in segmented ways. And I think we could even go that way with Lyme disease. It's like everything is Lyme, but like, can something else be going on? Is there an underlying autoimmune condition, or are we peaking that up? Or when you went into perimenopause, which I've had for patients, the symptoms are worse. Or when you're menstruating, that's what would happen. I'd see patients that were worse when they're menstruating. So hormones, how is that actually either supporting it or not supporting it? And so it was also to kind of to have that step back of looking at the person and the whole person, and also not just in Lyme disease, but Lyme disease and what are all the other factors that could be playing a role or impacted to make a person managed well or basically not managed well.
So I want to talk a little more specifically about how women are impacted differently with Lyme disease. And I'm going to kind of ask the question a little bit differently. If you can maybe address from an age perspective,
Mhm.
maybe women in their early 20s, women in their 30s, and maybe women a little bit older.
Yeah, so if we look at, and that's a good point. So if you're looking at like menstruating women under that are what's called like pre-menopause, they will, what you might see, especially if there's an issue with hormone regulation, like a woman with PCOS or endometriosis. Endometriosis might be more estrogen dominant, for example, or estrogen dominant conditions. What you'll see is these sometimes irregularities in the cycle, heavier bleeding, and symptoms that are related to like PMS. And so if you look at something like a menstruating woman, if there's a lot of PMS symptoms, what you'll see is several days before the cycle, you have something called prostaglandins that get released like 3 to 5 days before the cycle that helps with the shedding of the uterus to start the menses. And when the prostagland sheds, you actually have an increase of something called, what it sheds, and what you have is an increase in something called IL-6, which is an inflammatory marker. It's a cytokine, an inflammatory
Mhm.
mediator. And the thicker the lining of the uterus is, especially with women with those disease conditions or estrogen dominant, the more inflammation you'll be increasing up, right? And so what happens with that is I would see many of my women with Lyme disease, also with autoimmune conditions, where they would say like, I was feeling good, and then every time, like right before I get my period, I feel horrible. Like my joint pain's bad, my brain fog's horrible, my mood is dysregulated, I'm really depressed. Depression is related with inflammation, people don't realize. And then they would say, as soon as I get my period, I'm fine. And the reason is those prostaglandins aren't getting released, and those inflammatory markers are now like are not being aren't an issue. And so a lot of times with women, I'm working on getting that cycle again more regular and consistent. I'm working on maybe palliatively putting them on some natural anti-inflammatories like turmeric or boswellia like 5 days before the onset of the cycle. If they're more estrogen dominant, I'm looking at how their estrogen metabolism, how they're actually like their metabolates, how that's actually getting eliminated through the system. So what you'll see is as that gets more regulated, if that's an issue, there's no longer that issue where they are having like a flare like right before their cycle, or they're like right after I'm ovulating, I feel horrible. You'll start seeing that it just becomes consistent. So that's one. So if that's the premenopause, and then for women that are perimenopause and menopausal, the challenge with that is you have this huge drop in all the hormones, right? So progesterone, definitely, estrogen, even more significantly so. And then you'll also see after a woman turns 40, a lowering of things like testosterone. Now, the important thing to note with that is they all, and when people don't realize your hormones are very, very interconnected with your immune function. And so, like for example, estrogen helps when you do get ill or there's an inflammatory response. Estrogen actually helps with that. In high amounts, it can actually be what's called like pro-inflammatory. And then when you look at things like progesterone or testosterone, those are anti-inflammatory. And so now all those things that were helping to protect your immune function or keep infections or inflammation at bay are all gone away. And so now you'll see this where the symptoms are a lot worse. The hot flashes or the symptoms of Lyme disease are more significant. Or I'll be working with a woman that had Lyme disease maybe 5 years ago. They're going through perimenopause and their symptoms of Lyme are like way, way more significant than before. And so with them, we have to regulate hormones. Some of them have to get on hormone replacement therapy for a short period of time. Some of them we have to support adrenal glands initially because if your cortisol is completely dysregulated, that will downregulate your thyroid hormone and then the other hormones. And so everybody is different in that, but those are heavy times that people get hit. And if you look at even things like autoimmune conditions, those go up the highest during perimenopause and menopause, probably for the same reason. You have those things that were protective that are no longer there. Same as women will get autoimmune conditions commonly or thyroid conditions after having a baby when those hormones all drop down. So all of these changes women go through, men may just go through kind of a drop down of somewhat in testosterone. And I see that too, like men that have had infections for a long time that are young that have low testosterone, like for what is optimal for their age. And these things are all going to help to modulate your immune system. And so you'll see women overall, when you look at the studies, the women will have more symptoms of chronic Lyme disease, suffer. I think in the last data I saw, Lyme data, it was like 83% were women that deal with chronic long-term symptoms from Lyme disease as compared to men. So they may have it just as much, but women tend to have the symptoms for a longer extended period of time as compared to men as well.
Wow, there was so much there we could unpack. Well, I'm going to ask you this question. So, what is your advice, not for men with Lyme, but for men? My
Mhm.
book is called Love, Hope, Lyme, What Family Members, Partners, and Friends Who Love a Chronic Lyme Survivor Need to Know. What's your advice for men who have a woman in their life who has chronic Lyme disease? You just listed a whole slew of things, and again, the book is thick and goes into detail a lot about this. What's your advice for men who are supporting a woman like this?
Yes, I mean, the biggest thing is it's the same as when patients come to see me, is that they feel heard and listened to, right? I always say that that's just as much medicine as what we actually offer, because unfortunately, in this world of Lyme disease, as I mentioned, 7 to 9, it's probably more than that. I've had patients see 15 to 20 doctors before they get diagnosed. So there's a lot of dismissing. And so as a partner, the biggest thing is being open to listening, and also figuring out potentially, like, asking, how can I actually help to support, and realizing that, especially if you had the baseline of the way they were before, that this isn't always who they will be. And so that's always also a balance I have to figure out, because some of my patients, like, they're in relationships where they're married, but maybe 1 year into marriage or 2 years into marriage, their partner had gotten Lyme disease, and they may have only mostly seen them sick for most of their time. And so I've seen it that way, where, like, now they're better, and that they don't know, almost like, oh, this is different, like, where you can go out, we can have activities, there's, so it changes the dynamic. And so I think it's really important to see that and understand how to support it, and then and listen, obviously. But I've seen support on both ways, men or women that have suffered for a long time. Men, when, like I had mentioned, testosterone's lower, they may have more, like, issues with brain fog, focus. Women too, the same, irritability. And so there's something they call, like, Lyme rage or Bartonella rage. I've had, partners, or I've seen both partners, and the significant other might say, hey, like, does Bartonella affect the mood? And I'm like, yeah. And they're like, because their mood has been a lot better now that they're, now that they're working with you, and not even having shared to me that there was a little bit of distress in the dynamic in the relationship for the last 2 years when they had it. Because, when you don't feel well, outside of the illness, the infection is going to affect your brain, mental state, everything. But outside of that, just, like, not feeling well, you're not going to be your best. You're not going to be able to be the same way you presented as well. So it's just being understanding and supportive in whatever way you can is all you can do, really.
Wow. So we're talking to Dr. Jaquel Patterson, the book Women and Lyme, an integrative guide to better health. So a couple episodes ago, we had Dr. Rawls, Dr. Bill Rawls on the show. We talked about herbs in detail. And we went through, a lot of his protocol and as it relates to the Buhner protocol, et cetera. Can you recommend some helpful herbs for women's
Yes.
health?
So there are many pretty known protocols. I'll just mention some of them so that people can kind of also research on their own, and then some of the ones that I like. So some you mentioned, Fred, Buhner's protocol, and typically the herbs in that include things like Artemisia, Cryptolepis, Japanese knotweed, cordyceps. There's also, so that's one protocol, Buhner protocol. There's also Nutrimetics, and I use Nutrimetics a lot, which is Cowden protocol.
Mm-hmm.
And the Cowden protocol, there's a full one. I use what's called, like, a modified Cowden protocol. The one thing I wanted to point out with them is it's typically a mix of different herbs that you alternate every month. But the one thing I want to point out was they did have a study, same as some of the Buhner herbs. PubMed has studied many have shown to be as effective, if not more effective, than things like doxycycline for certain herbs like Artemisia, Cryptolepis, stevia, Japanese knotweed, oregano has been studied. And then when you look at the Cowden protocol, two of the ones that have been studied is Cemento and Banderol, and those also have shown effectiveness levels similar to antibiotics. And those were studied at University of New Haven. So Buhner's, we have Cowden. Some people use Byron White. Byron White is a mixed formula. Usually it's a lower drop amount. Some of my patients like Beyond Balance, which is like in a glycerate, especially for kids. The taste might be better. So you kind of, I think, learn from experience. I personally use a lot of the Buhner herbs, and I use the Cowden herbs pretty frequently, and the ones that have been studied. And depending on the person, like, let's say somebody has Bartonella, you might do slightly different herbs, like a Hooda would be an example of one. Or if someone has had Lyme disease or a tick-borne infection for a long period of time, it's going to be important to address what's called biofilm. And biofilm is when they call persister cells, or these infections that kind of don't go away, you want to put somebody on things like serrapeptidase, lumbrokinase, or even oregano and stevia. Those help to break down biofilm so that these spirochetes can't hide and go in remission and then, come out a year later. So those are really important to do. And the reason two of my favorite are Artemisia, Cryptolepis, and Cemento, which is cat's claw, because they're also immune modulating. and they're anti-inflammatory, and they also help the gut microbiome. So I tend to like those because many of my patients with Lyme disease may have some overlapping autoimmune conditions as well. So it kind of we can address a few things at one time.
Yeah, one thing you talk about in the book also is lifestyle changes, so
Mhm.
or considerations, I should say. So give us some of your advice on that.
Yeah, so this is always one of the tricky ones because when we look at lifestyle, we look at obviously just the general self-care, we look at exercise, we look at diet, and one of what I said tricky is with exercise, as you'll see, and I'm sure you've heard, it was like with Lyme disease, people can feel really, really not well when they exercise. So they might feel good while they're exercising, then they say 4 hours later they feel horrible. The reason is you can build up with exercise a lot of like lactic acid and acidity, and if your body's not working on, I would say like full tilt, you're not gonna be able to make maybe necessarily like rid of everything as well, like the toxins, and you might feel really bad. And so usually I'm telling people just to be active initially, like walking, yoga,
Mm,
Pilates, and being mindful of the heart rate and then trying to increase that up slowly over time. Because I've had patients that have been like Ironmen and marathon runners, and they're like, I can't even run now after I got Lyme disease, like 2 blocks without having shortness of breath. So you have to have grace on yourself and realize that you have to kind of build up. And I also see that where I have a patient I've been seeing, they feel amazing, and now they're like, okay, I'm gonna go, I'm gonna go hike 10 miles, and they feel horrible the next day. And I'm like, but you haven't hiked 10 miles in 3 years. Like, I'm glad you're feeling better with Lyme, but you're also deconditioned. So we have to build up slowly. Hydration is super important. About 64 ounces of a day. I'm not one that thinks you should do excessive amounts because that also taxes the kidney, and you don't want to too high of amount of water. But the reason that's important, especially if someone is on herbs or antibiotics, you want to make sure you're again eliminating. Like if someone is dehydrated, you're doing things that can cause what's called a Herxheimer response, you need water and hydration to help clear. So that's important. They have had studies on things like sauna, far
mm,
infrared sauna, and that's helpful for Lyme disease. I'm always trying to balance out how long, to be in it, because again, if your body can tolerate it. So usually we'll start off like 15 or 20 minutes, but
mm,
sauna, there's been tons of studies on sauna's effectiveness to decrease like your inflammatory markers, particularly CRP. So, and helping with mental health. There was a study in Finland that was like 20 years of studies on that of tracking people over time. So sauna is a great one. The one thing with that people do not like when I say is like grounding, but being mindful of where you're grounding because you don't want to be getting ticks on you as
mm.
you're doing it, but maybe it's sitting outside or the grounding mats or things like that to actually get connected, because you can really lose yourself when you're really ill in terms of um, connected to something bigger, and that's where the grounding helps. Or saying gratitude and journaling and things like that, I always tell people to are also important to have. For me, I did a lot of self-care by way of like meditation and yoga and those pieces too that also helped while I went through the illness. And then the nutrition. Nutrition's obviously really important. The foods that tend to be more inflammatory, like gluten, I try to stay away from for people. Alcohol, which usually alcohol or coffee, if it's excessive of each one, either one, I have to have people cut off, which they're not usually happy about because there's always one vice in that. It's either alcohol or wine. But they're again acidic, so they might aggravate the
Mm.
system. Dairy might be one factor too. So I'll usually go and test for foods to see which are more ideal for them. But you're just really trying to have a well-balanced diet, and diets that are colorful, dark green leafy vegetables, those are going to have more minerals and more vitamins. When you look at Lyme disease, it uses up a lot of need more mitochondria, it gets
Mm.
depleted. And so you need to have things that are, high in antioxidants, supplements, things like CoQ10, anything that's going to actually help support the mitochondria as a whole. And so you're going to get that from those foods.
So we're doing today's interview at the end of 2024. I know you're going to be participating in a conference that's coming up in early 2025. If you're
Yes.
listening to this podcast sometime way in the future, you'll have missed it. But tell us a little bit about, I think, what's called Lyme Healers.
Healers. Yeah. So I
Healers.
was really, because I think after I came out with this book, Women in Lyme, it then went into, wait a second, why don't we have a place where there's a lot of female speakers on Lyme disease? And so I connected with Dr. Mariah Hinchy and
Mm.
Dr. Lindsay Wells, who are very known in the Lyme world.
All right, we talked today with Dr. Jaquel Patterson, the author of the book Women and Lyme, an
I got
integrative
my book.
guide. There's a book if you're watching on YouTube. Once again, if you're watching on YouTube, give us a thumbs up and feel free to leave a comment. Dr. Patterson will be checking the comments and replying as appropriate. If you're listening to this on Apple Podcasts, please give us a 5-star review. Congratulations and thank you very much for all this information and for the conference and everything you're doing. Just want to acknowledge you uh, for the help that you've brought to thousands, if not tens of thousands of people. I encourage anybody to purchase the book, read it. It was a great guide to so many things. And as you just heard on the Love Hope Line podcast, Dr. Patterson is a wealth of information covering the entire gamut of what you might approach with chronic Lyme disease. Dr. Patterson, I want to ask you one final
Mhm.
question.
Yes, of
Uh,
course.
Again, this podcast is the Love Hope Lyme podcast.
Mhm.
Um, Give us a message or two about hope. Again, I'm sure you've been way deep personally. You
Mhm.
mentioned some of your experiences. You deal with a lot of people, and as we know, people listening to this, you can go way down because of
Mhm.
all the impacts of Lyme and the co-infections and even some of the mental stuff you said where people don't believe you. And
Mhm.
you've been to some doctors have told me that, they were number 100, which sounds kind of high, of the doctors
Mhm.
that people have seen. In a lot of cases, maybe the 99th was someone who identified the Lyme and then send them to someone like you or some of the other doctors I've had on the Love Hope Lyme podcast. Give us a message of hope to close out.
So always advocate for yourself. I think unfortunately in healthcare and in medicine, we don't, even me as a provider going, and I'm sure you've had this experience going into a doctor and not feeling heard. And if you don't feel well and you continue to not feel well, you have to, the providers or whoever you're seeing, it's a service, right? It's still a service that you're being provided, and you need to have, you need to be able to understand, why. You need to understand, you need to advocate for feeling better. It's not okay to just to feel okay. I have a lot of patients like, well, I'm not as bad as I was before, and that's not acceptable. You want to feel, you want to feel well and thriving. And so definitely, if you're not feeling like you have those like partners for support, you need to continue to seek that and ask and not feel, because that can definitely discourage hope 100%. Like if you don't have a doctor you're working with that makes you feel hopeful, that's also concerning, because I've seen that even in the Lyme literate world of like, this is something you're going to have forever. This is going to be a hard, hard road. This is, and how do you know that? Because I've had many patients that respond very well within a month and they're on their road to wellness really fast. So, also being mindful of the people that are in your healthcare journey. Are they people that are encouraging and uplifting, that you feel like you're going to get through this? So, because that you need to be around people that are hopeful. Then the other thing is like, what are those small wins that you have every day? I mean, we
Mm.
all, I have those, and have had those days are really tough, where you're feeling, dragging, you're exhausted, you just want to stop everything and hide and crawl under, crawl under your covers. But what I try to say is, okay, in those times where the patient's like, what is happening right now and today? And like I said, giving yourself grace is like, it's okay for me to sit here and do nothing today because I don't feel well,
Yeah.
and then tomorrow, I might be fine, and that's okay. So I think sometimes too, we want things to just be crossed off and over and done with. I see that with a lot of my patients that have like anxiety, is like that continued worry for the, usually it's like worry for the future. They say depression is worry about the past. And it's like, how do you just get that one step in front of you and each other? And sometimes it's saying those, like I said, those affirmations or gratitude, instead, so that it kind of still puts you in the present, so you're not thinking about what time I've lost being sick, or I shouldn't be doing this because I don't feel well, or what's wrong with me. Instead, thinking of like, I don't feel well, it's okay for me to sit here and read a book or to sleep until, and then tomorrow that might be better. So it's those little steps of hope, that can encourage, but you also want to make sure you're surrounding yourself around people that are also equally hopeful too.
All right, that's a great answer. All right, once again, I want to thank Dr. Jaquel Patterson. My name is Fred Diamond. This is the Love Hope Lyme podcast.